Hi, this is Angela with Angela's Nurse Toolbox. Let's talk about assessing your NG tubes. When these tubes are first put in, they are confirmed placement with an x-ray. When you are later on giving medicines, feedings, we are supposed to make sure it did not get dislodged and it is still in the stomach. So the way I see a lot of nurses still doing it is the swoosh method, where they're going to go ahead and take their stethoscope. They're going to put it over the abdomen, the stomach area. You're going to take a catheter tip syringe with about 30 mils of air. You're going to pull up, connect it, and they're going to push really fast right over, inject that air, and right over the stomach area you're going to hear like a growl. It's going to make their stomach, you're going to hear that whoosh sound. Problem with that, this is no longer evidence-based practice to continue doing that because we inflated our patients with a bunch of unnecessary air for checking placement, which can make them uncomfortable. So the way we're supposed to be doing it, and this is evidence-based practice, is checking it, the pH of the fluid that we aspirate. So to do that, you're going to take your catheter tip syringe, you're going to pull back a little bit of the fluid, take your pH paper, test it, and it should be very acidic if it's placed in the stomach area. If it's not acidic, then we would have to question whether it's in place or not and order another x-ray. I don't know about y'all, but down here, I have not seen anybody have pH paper. When we sit there and ask at sites, where's your pH paper? They look at us like a deer in headlights. They have no idea, and nobody has pH paper. We still see a lot of nurses doing the swoosh method. So comment, let me know which method you're using in your facility, if it's still the swoosh or if you actually have pH paper and where you're located. If you like, subscribe to my videos. This is Angela's Nurse Toolbox.